The number one reason for bankruptcies in America is a healthcare problem that was too expensive. Yeah, 60% of American families have less than $1,000 in savings. The US healthcare system is in crisis. And in this episode, I'm going to talk about how healthcare corporations are the parasite that are killing US healthcare and our citizens. What is the healthcare crisis in America? It's two things. First, it's the fact that it's more expensive than any other country in the world for the average American to get healthcare. Almost 2 times as expensive as the G20. In other words, the 20 top countries in the world, right, financially. So we're way behind on everybody else. We're paying a whole lot more than everybody else, and we're getting actually less. And that's the crazy part. The second crisis is that because healthcare is a business and an industry for most Americans, the fact of the matter is these corporations make more profit by providing less service. They up the rates of the cost of the services, they up the insurance premiums, and they reduce the service that they give to citizens and Americans so that they can make more profit. And in fact, they have to increase their profits every year. So what does that mean? That means they have to provide less service and charge more. So less service, more cost, less service, more cost, on and on, year after year, means what? It means people are getting less healthcare, they're getting less quality healthcare, and it's costing them a whole lot more. Some simple solutions, just right off the bat. The first is that the government could cap the price of insurance in the healthcare market. And they could do that, but there's so much opposition to government getting involved with business by some parts of the political parties in America that it's a third rail to start talking about that. They would much rather just kill public health insurance. The second thing for the public is that you could actually make it so there's a floor, a minimum amount of healthcare that these companies have to provide, right? You can say, okay, the minimum you have to provide is, and then list a dozen things that are really important, including preventive care. Now, some of these do that as a way of enticement and so forth, but it's kind of like only lip service preventive healthcare. It's not real super preventive healthcare. For example, in Germany, which has socialized medicine, the doctors often get bonuses, as I understand it, what I've read, that they get bonuses when they can help, like, Jonathan stop smoking. And I don't smoke, but to help Jonathan stop smoking, or to help Jonathan get his BMI, his weight down, or to help me work out in the gym. I get bonuses and the doctors get bonuses because prevention and keeping healthy, staying healthy through your life is far cheaper than paying for all the diseases and the surgeries and the hip replacements and everything else. See, it's part of a scam in a sense, which is to say that healthcare in America is very much sick care, because if they can just string you out and keep you sick, right? We don't want to solve the disease. We want to keep you on a continuity program of monthly and annual payments to stay sick, right? Because look, let me give you an example. Diabetes, type 2 diabetes. Almost all type 2 diabetes can be put into complete remission with diet and exercise. That's it, diet and exercise. So if the focus was diet and exercise, and there were programs set up to educate people from an early age, say in school, about diet and exercise, and keep people going to the gym, for example, only 22% of American adults go to the gym, keep you going to the gym, working out, doing those kinds of things, you wouldn't have type 2 diabetes. Instead, you've got 64-ounce Coca-Colas and French fries, which, have them once in a while, that's great. But as a diet, as a regular routine for getting your calories each day, it's an absolute recipe for, the cakes, cookies, ice creams, junk food, processed food, all this stuff is a direct driver for diabetes. So we don't shut that down. Instead, what we do is we charge people for insulin. We put them on a lifetime plan for getting insulin. And that just means money, 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 money for the corporations. So the healthcare system wants to keep people just on the edge of wellness and edge of sickness, right in that neutral zone. So they keep coming back for more. What is it? More drugs, right? More pain, more amputations, more all these problems. Now, at the individual doctor or nurse level, absolutely they want to help people as much as possible. But they're operating within the guidelines they're allowed to. There's an actual book, there's a giant book that says what are the different diseases and what are the allowable treatments. And they get paid to do those things. They don't get paid to get you, completely healthy. They'll mention it, they'll suggest it, they'll give you a pamphlet that says do that, but they're not incentivized in any way to do that. They're incentivized to see as many patients as possible all day long so they can run the money through the machine. We have a money-oriented system. And you, as an American citizen, as a human being, are the product. And what they have to do is they have to pump you full of drugs and procedures, and they make more money by doing that. And they also make more money by denying those procedures, but charging you a high insurance rate. So they keep upping the insurance rates because insurance companies have to make a profit, right? Instead, the solution is to go with a national Medicare program. So let's back up for just 1 second. In the United States, we have Medicare, which is basically government medicine paid for after the age of 65 and up. Okay, you get Medicare. Or if you're disabled, you get Medicaid. If you're in the military, you get what's called TRICARE, the military health, and you have the Veterans Administration for health after you've become a veteran. So there's all these other systems outside of it, but the big bulk of the American public is sitting here in a place where they have to buy insurance. They have to get it through their work, and they get charged at the work, and the company gets charged for it. They have to get it through Obamacare, which is the national health program for people who are low income, although conservatives want to kill that, and especially the folks that are in office today want to kill that. They don't want to have it anymore. And then the average person has to just go out into the marketplace, the insurance marketplace, and buy their own insurance. And so here's the problem. As more and more people have to pay more and more money, people are dropping out of these healthcare programs, which means that in order to be highly profitable, which they are, some of the most profitable companies in the world, be highly profitable, they have to charge more money to the existing pool of people in the insurance game. So what happens is the average American is having to pay more and more and more each year, and the insurance companies, again, are pushing down the quality of the healthcare that they're giving them and the amount of access to healthcare they're giving them. This is a big problem because it's your health and your life, and your friends and your family and everybody else are paying through the nose. Now, something has happened in what was called the big beautiful bill that Congress passed earlier this year, Trump's plan. And that idea was to say, we're going to cut the spending and the money for healthcare, for the Obamacare, and for other programs. And in doing so, everybody's premiums are going to go up. And there's some tax issues and some other issues, but fundamentally, they're making it much more expensive for the average person to get health care in the marketplace. For example, I just read a report the other day. The report came out and said this: if you make $84,000 a year, husband and wife, two income earners, one household, $84,000 a year, the increase in healthcare premiums, the insurance premiums for 2026 are going to average about $10,000 for those two people. Now, remember, they're only making $84,000 a year for two people. It's going to go up $10,000. If you're a family of four and you're making $125,000 a year, your healthcare premiums could go up by as much as $25,000. Now, the number one thing that Americans on average are reporting, if you're on the top 10%, right, is that money is tight. You can't buy as much. Inflation has really had a huge impact in the past 5 years. And so they're feeling super pinched financially right now already. And what's going to happen? The current government just made your healthcare premiums go up to take anywhere from like 10 to 15% of your income more to get basic insurance. Well, what's going to happen? What happen is a lot of people are just going to say, I'm not getting insured. They're just going to stop being insured. And the secondary problem to the healthcare system that we haven't talked about yet is bankruptcy. The number one reason for bankruptcies in America is a healthcare problem that was too expensive. Yeah, 60% of American families have less than $1,000 in savings. So if you have a medical procedure that's not covered because the insurance agency company says, hey, we don't cover those kinds of things, or, oh, you haven't met your deductible, or all these other different things, what happens is those people get soaked. They get just hammered. I had a small hand surgery last year, and the total cost for the hand surgery was in excess of $20,000. Now, fortunately, I pay insurance, but it cost me a lot of money. But if you had to have that surgery and you didn't have insurance, and you were, someone who was making in the middle median income, you might have to go bankrupt or not pay your rent or something to pay those bills because they will come after you. So it's a huge problem. In fact, the number one reason for a GoFundMe in America is someone's medical bills. Guess what? Nobody goes bankrupt or has to do a GoFundMe for their health care in Europe. In all of Europe, in Japan, in Vietnam, in China, in Australia, in New Zealand, we're like the only place in the world that treats our citizens' health as a product, as a profit center. It's so wildly immoral and wrong. And just think about it for a second, okay? If you've got money here to go for healthcare here, but in between that, you've got an insurance company that takes the money and then says, I don't know, we're going to take this much money, but we're only going to give you this much healthcare, right? That's how they're making their profit on that spread. So, isn't that just wrong? Isn't that just fundamentally morally wrong? Now, it doesn't mean the doctors shouldn't get paid. The doctors, the nurses, the healthcare providers, the medicines, the surgical equipment, the diagnostic machines, those things are important to pay for. But the insurance company provides zero net value to you as an American citizen or as someone living in America that's getting healthcare. Zero net value. Nothing. Medicare runs at a 3% cost. 3%. That's incredibly low. Why don't we just have Medicare for the whole country? We don't have to call it socialized medicine. We just call it Medicare. So every year, we just drop down 3 or 4 years from 65 to, say, 62 to 58. Every year, we just increase it like that. Oh, and by the way, we start by making all healthcare for all children, say 18 and under, free. Why wouldn't we? It's the future of our country, the healthcare of children, right? Food, medicine, whatever they need for health, free. It just makes sense. You're investing in the future of your country and these young people. You want them to be as strong and healthy and fit and capable as possible. Why wouldn't you make all healthcare, preventive healthcare, nutrition free? It just makes sense. But we don't do that because everything is a market. Everything is a profit center. And you, as an American, are a product. Your health is a product for other companies to profit off of. And in fact, actually, I said that incorrectly. Your not being healthy is the product they want so they can feed the system and make more money. And guess what's feeding the system? You are. Your life, your health, your quality of life, your quality of health. We should be doing what the other countries are doing, which is to say, make Medicare nationwide for every single person, invest in our children, and stop spending so much money on things that we don't need and take care of the things that make sense, which is the people in the country, especially the children. If we made healthcare free and focused on preventive healthcare, we would be paying half of what we're currently paying. Forget the increases that are coming. Forget the doubling of your prices that are coming because of the new big, beautiful bill, supposedly, whatever they call it. It's like your prices are going to double for your insurance. Forget that. We can actually go half of what we're paying now and get the same kind of quality healthcare they get in Switzerland, France, Israel, Sweden, Japan. Just go down the list. Why don't we do that? Is profit for healthcare insurance corporations more important than your life, than your health, and the health of your children? I don't think so. What do you think?
But fundamentally, if the health insurance companies in the US, if they were not allowed to make a profit, would that work and would that solve a lot of the issues?
Well, you have to ask, what does the insurance company do? It acts as all it is a middleman. It's either if you have if the government's paying for the insurance, let's say like Medicare, right? So with Medicare, the government pays for the insurance. You don't need a health care company because the government pays directly to the doctor's office and to the hospital. Why do you need a bureaucratic layer in between of health insurance company? What would a healthcare company do?
I don't know.
Exactly. I mean, at the end of the day, what are they doing? They're just pushing paper from desk over here, government desk, to doctor desk, and they take a cut in between. They're just a middleman. So Obamacare was created by the Heritage Foundation. The Heritage Foundation is a far right wing consulting group that gives talking points and policy points to Republicans to try and push laws in Congress that are very conservative. So back, I think, during Clinton's era, and there was Clinton, and then after Clinton, Mitt Romney, and so forth, all talking about healthcare, trying to get this. Now, Clinton wanted universal basic healthcare for all Americans, sort of like the basic healthcare in Switzerland and Germany and France and so forth. And the Republicans didn't want that. So they made a compromise, which was to have what we call now Obamacare. But that was a Heritage Foundation program, which is to say government funded healthcare for poor people, right? So super discount or free for poor or low income people. But it was run through different companies, different health insurance companies. So the government paid the health insurance companies, and then you would get a health insurance card from that company, not from the government. And so the companies got to make money, which is why they liked it. And they get to keep raising their prices, and the government has to pay for it. But that's what's called Obamacare. Now, in these red or Republican states, they hated Obamacare so much because they were against Obama and against anything that he was doing for the public. The problem is that most of these states, a huge number of many millions and millions of people are on Obamacare because they're poor, and poor Republicans. Like there's poor Democrats, there's poor Republicans, poor unaffiliated, right? But they said get rid of Obamacare, and then when that money is cut or isn't spent by the state, or the state refuses to take the money from the government for the portion of Obamacare, then they just lose their health care. And they're like, well, what happened? I lost my health care. I lost my Alabama care or my Georgia care. No, it's Obamacare. So they don't know what they're getting. They don't understand what they're getting. They say, I hate that government intrusion into healthcare, but I sure want my Georgia healthcare. Well, your Georgia healthcare is paid for by the federal government. It's so important to understand how health, as you get older, health becomes more important, right? Unless someone has a childhood disease, in which case we want to take care of their kids, of course. But there's an old saying that says this: a woman with her health has 1,000 dreams. But a woman who is very ill only has one dream, and that's to get better. And so part of the American dream should be that you get health care provided for through Medicare, which we already have. Just expand the Medicare to cover more people. It's really simple.
Is the public, the American public, aware of this, but they just don't have any power to ask for it? Or is it just not as obvious as it is once you've educated yourself and understood the system?
I think it's both. I think first, many Americans don't know how the healthcare system works. They don't understand where the money comes from. They don't understand how much profit. I mean, I think last year, U.S. health insurance companies made $25 billion in profits, something like that, which is a massive amount of profits, right? And then, of course, they're doing tons of extra work. That's profits in and above the extra work that they did. But a lot of the work that they do isn't necessary because Medicare would cover it. So Americans don't understand how the system works, so therefore they're not opposed to how they're being abused. They don't understand what healthcare is like in other countries. And they've been fed a mythology that, oh, you have to wait in long lines and you can't see somebody. And yeah, it's different because you're triaging, meaning you're taking the most important medical urgent cases first, and they're taking the least important last, right? So in other words, the person with a gunshot wound gets treated first, the person with a sprained ankle gets treated last. You may have to sit in the emergency room for 12 hours for your sprained ankle because someone came in and their bike got hit by a truck when they were riding. These things happen. So you have American healthcare is amazing for the emergency room. It's amazing for high-end science and medicine, like cutting-edge medicine, some of the best in the very world. And it's very good for doing things that are sort of like keeping you on maintenance drugs. They've really perfected how to keep you on maintenance drugs for a long time. So they don't know, and they don't have the power, but there's also another element, which is that they don't believe. And there is a wide swath of America that believes that they believe the trope from the 1900s and the 1800s, which is that if you're poor and you're broke and you're unemployed, it's your fault. Certainly people have problems, and certainly some people could do better. But for the vast majority, people are doing as good a job as they can in their life. And there's always been poor, and there always will be poor people. And they're not poor because they're immoral. They're just poor. They're hardworking. Many people are working 2 jobs just to pay the rent. And that's not lazy. That's not stupid. That's just the way their situation in life. And they deserve to have health care. They deserve to not have to go bankrupt or to do a GoFundMe because little Susie gets sick. Makes no sense. It's a radical, inefficient waste. So, for example, like I said, I think it was like $25 billion in profits last year for healthcare insurance companies. That's just the insurance companies, which is amazing. It's ridiculous. It's unnecessary. It's just wasted money being taken out of people's pockets. So what do? Well, I think we can do 3 things. First is to call your congressman and senator, write them an actual physical paper letter, right? I was going to go look for a pen. Write them a letter and tell them, I want Medicare for all. I think that we're getting killed by this healthcare insurance industry. It's just wiping us out, monetarily and health-wise in this country. We need Medicare for all. That's the number one thing you can do. And if you have a radio station or a newspaper, call them, write them, and just get the word out there. Start talking about it. If we don't talk about these issues, we can't understand that most of us actually agree, which is true in America. Most people want Medicare for all, but then there's all the politics. So number one, write to people, talk to people in power and importance. Call your local podcaster. If you know someone's a podcaster, get on there, put a note down below that says, I want Medicare for all, right? Why not? The second thing you can do is take care of yourself. The better you take care of yourself, the less you'll need healthcare. What does that mean? It means eating better, as eating as good quality food as you can, organic, locally grown, fresh, not in a can, the least processed food. It means taking, if you're over 50, take at least a basic, over 40 probably, a basic multivitamin like Centrum or something like that. I'm not promoting the brand, but just take a multivitamin because there's longitudinal studies show that taking vitamins does work. The third thing you can do is work out. Working out is so key. Physically moving your body is key to health. We're going to talk more about this in the next video, but sarcopenia and osteoporosis, loss of muscle, loss of bone is what makes you fragile, which destroys your health because muscle mass, muscle strength is medicine, right? Listen to that. Muscle mass and strength is medicine. Why is the farmer with a grip like a gorilla? Just the guy's just got this incredible grip, right? And he lives to 90, smokes cigarettes and eats bacon. Well, because muscle and strength and using your body keeps you alive long. We're going to talk about that. And then the last thing I would say is this. Well, actually two more. One is sleep. You've got to get deep, good, restful sleep. You've got to get sleep. Sleep is magic. Sleep is, your body heals most while you're sleeping. And if you're not sleeping well and sleeping enough, you're not healing well and healing enough. And that just down the road leads to bad things you don't want, right? And the last thing I would say is have good relationships, because they've shown, again, with these longitudinal studies called blue zones, like where do people live to have like old blue hair, that kind of thing. Like in blue zones, it's about they exercise, they eat well, but they sleep well, but they also have these beautiful big family relationships, lots of family, lots of friends, whether it's church, mosque, or synagogue, or whether it's your community center, your neighborhood coffee shop, whatever. They have people they know by name and they have friends who like them and care about them. And when you have that, it just does something to your body's immune system. It boosts your immune system. So these things are all immune system boosters. I highly recommend it. Take care of yourself, right? Don't smoke. If you smoke, we have something for that. We can show you that. We'll put a link down below called Stop Smoking Forever. We can help you stop smoking. Take good care of yourself. Enjoy your life. Be happy. Happiness, actually, they've shown that happiness is a health booster. Why wouldn't it be, right? Sadness declines your health. Happiness increases your health. So I think, don't worry. Be happy. Do the things you can do. Take control of your health and your life. And remember to write your senator and congressperson and tell them, I want Medicare for all. And put your notes down below. I want to hear from you. Put a note down there. Let me know what you think about healthcare in America. Should we have Medicare for all? Should we have healthcare for all? Should we make sure that the prices are like people are paying in Europe and Japan with the same high quality that we get here already? Why not? And if not, like I said, why not? Put a note down there. I want to hear what you have to say. Like, subscribe if you thought this was a good video, and we'll see you on the next one.